Okay, why don't you introduce yourself?
My name is Harry van der Zee. I'm from the Netherlands and I'm a homeopathic physician. And I'm specialized in treating epidemics and post-traumatic stress disorders.
And have you been to disaster situations before?
I've been mostly to war areas like in East Congo and Burundi, Rwanda.
And I'm curious, what type of techniques do you use for treating post-traumatic stress disorder?
Well, what we're using is a specific homeopathic remedy that has been designed for that. There are there are different sorts of trauma, of course, and for each sort of trauma there's a special remedy designed.
And what's the homeopathic remedy that's designed for that?
Well, it's just called the remedy for natural catastrophe trauma.
What's in it? What's its active ingredient?
It's not being made by using chemical substances. It's being made by imprinting healing information directly into water.
How's that done?
That's being done by a specific procedure, which is, I'm sorry, a proprietary secret by the one who designed it.
Is it using standard homeopathic modalities of dilution?
Yes, it's very similar to any other type of homeopathic remedy. The only thing is that with usual homeopathic remedies, you start from substance, and then what you are left with is the information that is still imprinted in the water. And with this process, you imprint the information into water directly without the use of substance.
So you're not even using a substance to begin with?
No. No, you imprint it on water directly. You can also use the normal homeopathic remedies for treating this, but then you usually have a set of remedies that you need, and you need to have skills to find the correct remedy for each patient. And by designing one remedy that in principle can cover all patients suffering from the same trauma, you can use also people that are low skilled to nevertheless have successful treatments with patients. So that's why we designed this ideally for developing countries, where there's often a lack of medical care, and where we can train people in just a matter of hours how to successfully treat conditions like this.
And what's been your experience with this?
My experience has been mostly with genocide and war trauma, and with rape trauma in Africa. And I must say I was just amazed by the results that you can see. People that had been having flashbacks for many years from the genocide in Rwanda, for instance, they got back into a normal living within a matter of days or weeks, being able to sleep well again, being able to get rid of those flashbacks and come back all day, to concentrate on their work, on their study, to think about their future again, to make up with their neighbors, for instance, which are from the other tribe. So yeah, we've been seeing very good results.
Did you do any controls with comparing it with placebo?
Well, you can't do that in a situation like where we're going now in Haiti. You can't treat people with placebo in conditions like that. I mean, you just have to give them the real thing. So for that, we would need to do studies when you have a more calm down situation, and when the need is not as acute as it is now.
And have there been any studies like that done?
Not with trauma. There have been studies done with epidemic diseases.
Are they published?
Some of them have been published. They're actually before, like in the past, like 100 years ago, there were several homeopathic hospitals in the United States also, where they were treating epidemics like cholera with great results. But once antibiotics and similar remedies came on the market, it was kind of forgotten, and homeopathy was less used for conditions like that. But what we've seen now in Africa, where treatment is often not available at all, or with very low skills, meaning that people get wrong medications in wrong doses and things like that, we see that this kind of treatment still is very useful.
Now, don't take this question wrong, but what do you say to people that say what you're doing is no different than placebo?
Try it out.
I'm sorry?
Try it out. Select some patients, give it to them, and see what happens.
In a randomized, double-blind method?
You can do it also, but I mean, we won't be able to go to Haiti and do a randomized double-blind control study. I mean, that's not the situation, but you can do that. Anyone who is interested in doing a study like that, most welcome.
Have the studies that you referenced before, have any of them been randomized double-blind?
If you talk about homeopathy in general, several. There have been hundreds of studies done, and several of them also randomized double-blind.
Okay, well, thank you very much.
You're most welcome.